Hello, good afternoon. I hope that you are doing well. Today, we are having one of the days where whatever can happen will happen. So, unfortunately, had to shift the webinar, but I'm so excited that we are here and we are live. And I hope that you are well and that you are having more peaceful start to your weekend. Today, we are getting back into this conversation to discuss your path into healthcare and chat about why this particular area, healthcare in the US, is the way that you should go if you're interested in entering healthcare in healthcare, but you're not sure whether you should come in on the clinical or the administrative side. So today we are going to pave the way for you to find success in the area of US healthcare system. So thank you so much for being here. Thank you for your flexibility as we had to pivot. So before we get started, I want to know from you, where are you in your healthcare journey? Have you ever worked in healthcare before? Is this something that you have maybe done in years prior, or you maybe are pivoting from being in the clinical side to the administrative side, or are you brand new to healthcare? So let us know in the comments when you get a moment. And yeah, excited to see where everybody's experience comes from. All right, so a little bit about me. So if you are not familiar with who I am, my name is Jasmine Feliz. I'm so excited that you are here in this space today. I run Inlera University, and Inlera University, we are committed to alleviating the stress and confusion in the business of healthcare. It started out as a very side project because I felt like people really needed the support, because everyone who was coming into the healthcare industry on all different sides of healthcare were just really confused about what happens in the back end of the healthcare system after the patient visit takes place. And so we just made it a little bit a side project to make some videos and help people to kind of connect the dots and fill in those empty spaces where we were all feeling a little confused about what really happens. And so with that, fast forward a couple of years, started building some content here on the YouTube space and then online, and now we have courses as well. So I have more than 6 years now of experience in the healthcare system. I've had a medical billing, credentialing, and revenue cycle focused company for about 20 of those years. And so I've got a little bit of experience, a lot of experience in the private practice sector, also worked in the hospital systems for a little while as well. A lot of experience in areas of the administrative side and just a little bit of experience on the clinical side, some overlapping. So I'm excited to kind of shed some light for you on what's possible in the healthcare system on this side of the coin here. So while we get started, I'm going to just quickly share what you can expect from our day and our time together. And so first, we're going to go into the opportunities here in the healthcare system. So where to start, and then what exactly is this topic of kind of healthcare administration or the administrative side, the business side of healthcare, a lot of different ways that we phrase it, but what's the back end of the healthcare system and what can we expect to see as far as opportunities for you? And we're going to talk about discovering your role. So really talking about what is included in some of these examples of the roles in healthcare, and helping to kind of shed the light on what's possible for you if you have certain skills that might be transferable. Next, we're going to go into kind of really, what is the path? What's the pathway to getting you to from where you are now to being successful in healthcare? Then last, we're going to talk about the future. So really getting into overcoming the things that are holding you back from this area, from getting you into healthcare and from your own success. And then we're going to talk about what support options are available to you according to what we offer and other places that we know are available online and in other spaces for very inexpensive or nothing at all. So if you could just let me know, how am I doing on sound? Do I sound okay? Can I get some confirmation from the team? Just a thumbs up or some message in the private chat. Is quality of the sound okay? Before I continue. And the last webinar, when we ran this webinar, we had some audio issues. So I want to make sure we don't have a repeat of that. Feel good? Yeah. All right. Let me know if there's any issues with quality, please. Okay. So we're going to do a giveaway. Okay. Perfect. Thank you. Thank you for that confirmation. And so we are giving away 2 months of our basic membership, and you may not know what that is at the moment. And so I'm excited to give you a little insight into what that means towards the end of our webinar. But we have some courses, mini courses, and other opportunities for you to get connected to support in the business area of healthcare through our memberships. And so the basic membership has quite a bit already in it. And so we're giving away 2 free months of that membership. And so if you would do me a favor and in the comments, just write the word basic. So, and have you put the word basic in the comments, and that will enter you into the giveaway. And so we're going to give a couple moments for that to take place. And then I will share our stream. There we go. Okay, thanks. Thanks for the confirmation about the sound. Awesome. Let's see. All right, let's keep it moving. So question for you, what is your biggest fear or challenge right now while starting your career in healthcare? What are you finding is kind of keeping you in that place of not moving forward because of maybe fears or feeling like you've got roadblocks in the way or things that are holding you back? Whether it's things that you know that you can solve, which is like education or getting the training that you need or whatever it might be, let me know in the comments, what are the things that are holding you back? All right, so opportunities. So let's get started on this conversation of what exactly can you expect in this healthcare system in the US. So it's important to know that in the healthcare system here in the US, we are seeing rapid growth. I know a lot of industries, they've been kind of up and down. Healthcare has been very consistent. And of course, as you well know, during the pandemic, we of course had seen a surge in opportunities because of the deep need and the administrative burden as a result of the folks that were needing to access the healthcare system during that period. And so in addition to a typical consistent need in healthcare, we've seen quite an influx as we've seen things start to shift in access for technology. We've seen people creating new products that support our patients, which also can add to what happens on the back end of the healthcare system as well. And then, of course, we have a population, our baby boomers that are advancing in age. And so all of these reasons create a deep need for our healthcare system. And so I will want to kind of share with you just a moment, take a look at this graph. I want you to take it in because, wow, when I saw it, it blew my mind. This was a profit forecast that they had for healthcare, the healthcare system. And so these are billions. Let's just make sure you wrap your head around that, billions of dollars. And so this is the money that's moving through the healthcare system. And so knowing that in our healthcare system, we've got over $1 trillion of money moving through our healthcare system. And so we have the resources available to be able to, of course, care for our patients. And when we are having this requirement or this need to kind of add additional support around that caring for our patients, that also includes people like you to be able to hold the system up and make sure that our patients are supported and that our practices are able to do what they need to do to be able to provide exceptional service to our patients. And that means like making sure that things run smoothly, making sure the practice, the money in the practice moves through the practice, making sure that patients themselves are having the right kinds of care and are being able to be supported in their journey through healthcare, through that particular practice or that healthcare system. So with that said, the money that is floating around in the healthcare system is there to keep the healthcare system thriving so that we are able to provide better service to our patients and hopefully have better patient outcomes. And so there's some numbers here that talk about the number of jobs and the payroll. So this was $1 trillion in 2018 of specifically for payroll. So this is, we're talking about multiples of trillions of dollars when we're talking about the entire healthcare system, but just for payroll itself, supporting those individuals, supporting healthcare system, over $1 trillion in 2018. And so we're beyond that now that we're in 2025. These are the last numbers that were reported in a survey. And then about 1.2 million jobs that are opening every single year. So you recognizing that, as we continue to grow, these numbers were reported before 2020. So you can imagine that we've grown even more than that since the pandemic. All right, so I've already covered some whys, and I just want to go over a little bit more deeply why you should consider joining the healthcare system. So it is the fastest growing industry here in the US. So from 2020 to 2030, we've expected the growth, or they've forecasted the growth to be about 16% every year. So the growth just consistently growing every year, feeling the new jobs opening, hopefully expanding on the possibilities for advancements in patient care. There's just a huge growth, and that growth is just consistent, right? And this is one of those things, healthcare system it has staying power because we all need healthcare. Even in wellness, meaning we are feeling well, we still want to make sure that we can maintain our wellness by seeing our providers with our preventative care and preventative services. All right. So next is the salary. So this is the thing to think about is in the US healthcare system, our average salary is about $60,000. So average, and this is of course talking about healthcare leaders all the way down to those who are entry level, but that kind of middle ground is about almost 61,000 a year versus a national average of about 47,000. So there's a huge difference in what we see in healthcare versus other industries. And so definitely salaries are a big perk. So next is upward mobility. So healthcare system, we love developing our folks and watching them continue to expand in the healthcare system. So we have lots of individuals that come in through entry-level jobs and then continue advancing up to the place that they would like to be based on the desired and their interest in continuing to seek training and continuing to develop themselves as individuals. And so there's lots of opportunities to basically be coached and mentored and supported from this entry-level position all the way up to wherever you choose to be, an upper-level leadership position or beyond. All right, so here's the problem. Here's what's going on in healthcare. So there are clear lacks of efficiency. So we've realized in our healthcare system in the US that we really have trouble making sure that the money that we're spending is actually being supportive for our patients. So we have lots of money that's being spent, but there's lots of things that are going wrong because they're still kind of spinning wheels, and somehow our patients in some cases are still not getting the improvement in their healthcare outcomes that we see happening in other countries. So we rank about 22nd. We rank 22nd out of 27th in the study that was done related to how we utilize our dollars to create more efficiencies in this healthcare system. We also recognize that there's massive administrative load. And so this goes into that lack of efficiency. So our ability to use the money that's coming into this healthcare sector to be able to improve what happens on the back end of healthcare and streamline things so that we have more focused, more attention on our patients, on our patient outcomes, and the possibilities for more, we'll say, attentive and focused patient care. So we also have this challenge of technology that is just all over the place, right? Fragmented technology means that there's lots of pieces of technology that maybe don't quite work well together. And so we've got a challenge with the way that we care for our patients and the way that we serve our patients on the back end on this administrative side. So some of the technology that we're using that just does not work well when we're trying to use this to have a better, more successful patient journey. Last is patient engagement. So we have all of this technology that we're using. However, we realize that somehow we are not able to support our patients in a more meaningful way. So as a part of this patient journey is also the need for the patients to feel seen, heard, and understood, and also clear understanding of what is being done with their care and feeling like they're completely in the know. And unfortunately, some of the technology being so fragmented and some of our folks maybe not having a deep enough understanding of the ways that they can also benefit the patient journey, all of that results in this patient engagement scoring being a lot lower. So what is the solution? So my belief and our belief here at Inlera University is that you are the solution, because we as individuals on this business side of healthcare are driving a lot of the efforts, as we just talked, the patient the software is not being necessarily as influential in supporting our patient journey. We also recognize that sometimes because we're so busy, the administrative load can be so much. So it is really the bridge between those things, our patient experience and what we need to make sure that our practices are thriving, has to be individuals and folks that are equipped well with the right kind of knowledge, with the right type of confidence and energy, focused on improving our patient experience and focused on improving the ways that we serve our patients from a place of improving knowledge and developing better skills, while also taking into consideration that deeper why. All right. So technology, we've talked about this briefly, but it's so important to understand that we've got such a growth and expansion in technology that one of the most important things that the qualities that we need in our new folks coming into healthcare system is the embracing of technology. We need our folks to be desiring to leverage the technology that's available and really see possibilities, the possibilities of using this technology to help streamline. And I say this from the perspective of concepts like AI. There are so many folks that have this kind of fear when the term AI is moved around in the healthcare system. But what we need are people who are really looking at healthcare through the lens of what's possible and dreaming up utilizing these tools to help support our patient outcomes. There are a lot of practices in healthcare systems that are embracing the use of technology to serve our patients. And we need our individuals that are serving, so folks like yourself that are serving in the healthcare sector, to also see the possibilities of how technology, new technologies such as different advancements in AI, can actually be something that supports not only our own job, the ability for us to do more on this side of healthcare, but also overall patient experience and possibilities for us to serve our patients more deeply. So let's talk about the different ways that you can move in the healthcare system. So where you can start in your healthcare journey, there are really there's different possibilities based on your past experience. But let's say you're starting entry level. You're just coming out of, let's say, high school or college and have very minimal experience, but a drive and an excitement to be able to serve. Entry level opportunities are fairly endless. Actually, you might see here that there are some areas that are listed that maybe you didn't know we would consider as entry level, but billing and coding absolutely can be entry level, because there are areas in medical billing and coding where there's absolutely possibilities for someone to have come with fairly minimal training. So going out and getting a training program or a certificate and coming into healthcare with only that experience under their belt. That's absolutely possible. Other places like administrative assistants for our healthcare providers and leaders, our patient service representatives, that's really a customer service representative, being able to know a little bit more about some of the healthcare elements so that they can also be supportive in our patients' experience in the way they move through the practice. All right, so mid-level is the next stage. So we start talking about some supervisorial positions in healthcare, such as like our supervisors, our managers, our other coordinators, and the technicians that are working kind of in the background to make sure that things like our software are running properly. So that we would consider mid-level, and then all the way up to senior level. So let's say you're coming from another industry and you've had a lot of high-level management experience, and you go out and you get some training. Maybe you get your master's in health administration, and you now have both your training from previous positions in leadership as managers or supervisors, and now you have your master's in healthcare administration, you could easily move into mid-level positions or even a senior level position as well. So let's talk about what is the purpose of our individuals that are serving our patients. So the reality is that our healthcare administration teams, they serve one of the most vital roles because they truly are the drivers of our patients' experience. So we talk about our receptionists and our scheduling team being the face of our practice, the voice of our practice. They are the first touches that our patients have with our medical practice and our organizations, right? So when we have our patients interested in seeking care at our organizations, these are the first folks that they're speaking to. They're folks that the majority of the folks that are tending to our patients throughout their experience and their journey. And they also are the very last folks that actually are going to see our patients off or move them into wherever else they're headed, sending them to other specialists and those kinds of things as well. So it's so important to recognize that they are the ones that are actually seeing the patients the majority of the time. All right. Okay, so one more giveaway here. So we're going to give away a pro membership. And like I said, we're going to go over membership levels, but if you can just type pro in our comment box and we will run our giveaway tool and send you your pro membership. So go ahead and type pro in the comment box or the chat box, and we will enter you into our giveaway. Give you guys a moment to do that. All right, so let's go in. So let's talk about what exactly interests you in healthcare. I'm very curious to know what is most interesting to you. So have you already your interest been piqued by things that we've talked about here, or have you already interacted with someone on the healthcare system that has a position that you're interested in exploring? What is the field that is interesting you most, or what area is interesting you most? Let me know in the comments of the chat, please. All right, any questions coming up? This is one of our first pauses during our webinar today. Any questions from the audience? All right, I'll keep an eye out for questions and we will continue on. Okay, so let's talk now discovering your role. So in healthcare, in this system, I just broke it down for you. We have lots of positions. I went over some of those, the entry level, mid-level, upper level, senior level. On this presentation, I want you to take this in. This is the revenue cycle. So the slide that's before you is a representation of how the money, or really the patient journey, but we call this the financials, move through our medical practices and organizations. So starting at the very top, it's like a clock, right? The referral, and then moving to scheduling and visits and claims and all of these things all the way back up. So this is our patient journey, right? So this is the way that the money is moving through the organization. We call that our healthcare revenue cycle. It's the way that finances are generated for our medical practices and organizations. Every section that you see represented on this revenue cycle that has an orange circle around it is driven by our healthcare administrators. So it's really important to wrap your head around that we have about 90%, maybe even 92% of what takes place in the healthcare sector is actually in the practices and organizations are driven by our healthcare administrative team. So the team that is on the back end that maybe you don't realize you're interacting with when you're on the patient side, those are the folks that are really making sure that these healthcare organizations and practices flow, like business flows, and hopefully that they thrive and that the patients have a really solid and beneficial experience during their time at the practice. So let's talk a little bit about what exactly these medical office receptionists do. So having kind of put your patient hat on in this moment and think about the ways that you interact with our medical office receptionists. They're the ones who are welcoming you. They're the ones who are checking you in. They're the ones who are probably routing you towards the clinical team. They might even be the people who are checking you out and saying goodbye and making sure you have your next appointment, right? They're the ones that you're speaking to over the phone. They might even be there to help you with your paperwork and make sure you have what you need in the way of paperwork. They are there when you have those moments of stress, when you have those moments of confusion and looking for clarity. So they're there to help you navigate all of those moments of kind of trying to decide what your next step is, or make sure you understand what the providers told you in the back, right? So they are there to help coach you through that. They also are making sure that you have your appointments scheduled. They're making sure that they confirm your appointments. They're helping the providers make sure that they're available. So they manage the provider's schedule so that they have availability for your appointments, and that make sure that they have availability to be in the practice around their own other meetings and responsibilities. They're also the ones who are notating, kind of putting information into the patient's account so that everybody's aware of what's happening with our patients from an administrative level, making sure that everyone's in the know. So let's say our patient has communicated a trip during maybe a monitoring season, where they have let's say a heart monitor or some other kind of remote patient monitoring tool, but the patient has reached out to let us know that they're going to be out of town and now have a shift. They're the ones who are going to notate our patient's account and communicate to our clinical staff that kind of information. So they might also be fielding this really important information from our patients that give an update to the clinical team about what's happening. They're the ones who are likely communicating about prescriptions and refills as well, to get that to the right team, maybe even the referrals to outside practices. So lots and lots of kind of inter-office communication happening that's supported by our receptionist. So many responsibilities that really help to make sure our patients have a really solid experience. And so let's talk about what type of qualities, like what are the things that you want to have as a patient medical office receptionist if you are interested in entering into this role. So we really want to see that you enjoy interacting with people, because as I just explained, you're going to be doing that quite a lot. We really want you to be enjoying the challenges that you're going to be facing. So there might be questions that you're getting from our patients, questions that are coming in from other practices and even insurance companies or other vendors that you have to help answer. So really getting enjoyment or fulfillment out of helping people navigate challenges. We also want you to recognize that you enjoy being the face and maybe the voice of the practice, being the one who creates a really welcoming environment, whether that's digitally, by phone or by email or by the patient portal or in the office itself. We want to make sure that you're clear, that you're comfortable with being in a fast-paced environment, because truth is this industry for our medical office receptionists can feel a little bit like they have an old, I guess it's like a GIF or something, where the receptionist has like 8 arms and like an octopus, because they like have to reach all these different places at one time. And it's true, our receptionists have a lot going on and it can move super quickly. So when their day starts, they're kind of up and running, right? We want you to have customer service skills. We want you to be able to kind of enjoy helping people when they're feeling stuck or feeling frustrated, right? This is the day in life of a biller. So on the entry levels, we talked about potential entry level roles, right? So our medical office receptionist. Next is our medical biller. So our medical biller has a similar responsibility of interacting with a lot of different folks in the practice. They also are doing these things like making sure claims go out, payments get posted, working in a lot of technology and a lot of portals. So our insurance portals and our clearinghouses and the software itself, the medical practices billing software as well. They're the ones who are collaborating with their coders and other folks to make sure that the claims have what they need so that they get reimbursed. They're in touch with insurances. They're doing all of these things that really help to make sure our claim hopefully is going to get reimbursed the first time. And so a lot of effort going into that. And so also having the responsibilities of addressing concerns because they're the ones who are in charge of our patients' financial experience with the practice. So they're often there to kind of be the coach as well for our medical office, front office, back office teams that are speaking to our patients to help them feel clear about what's happening with our patients' accounts. And then they are oftentimes the ones who are speaking to the patients as well and trying to address and support their patients through issues and questions that they have about their patient's account. All right, so how do we know if medical billing is for you? So the deal is that our medical billers have a special skill set that's very different than our receptionist. So yes, there are practices that I've seen billers be receptionists, but the role and responsibilities are quite different. So it's like they're taking one hat off and putting another hat on. So what's the difference here? So we see our medical billers having lots of attention to detail. They also are folks who like to investigate. So they're the ones who are really digging in and really trying to get a clear understanding about what is wrong with our patient's claim or what is wrong with this patient's account to make sure that it gets resolved. All right. They have great communication skills. So again, they're the ones who are reassuring our teams about what they need to know with our patients' accounts and training our teams on how to communicate with our patients about balances and things like that. So communication skills are vital. They also are the ones who oftentimes are speaking directly to our patients, sometimes even our leaders in our practices that they have to speak with on a regular basis. So communicating effectively is important. They really do have to have a level of learning because they're constantly learning about new rules and regulations and trying to keep up with the changes that are happening in the healthcare system on a very regular basis. They also are like our medical office receptionists, multitaskers. They have a lot of variability in what they're doing from day to day. Most of our billers have kind of micro roles that they fill in this role of medical billing. So they might be doing data processing at some point with their payment posting, for example, or charge posting. Then they might also have the responsibility of speaking to our patients or training, which is a little different, right? You're using a completely different skill set. Then they also might be someone who's having to call and follow up on claims, different skill set to kind of argue their point and make sure that our claims appeals are getting processed correctly, right? So that's a different skill set than the other two things that I mentioned. Okay. There are also things we see that our billers like to question things. They're the ones who are always kind of wanting to push back and argue their point and hopefully find a solution that's going to result in our claims getting reimbursed. So if you find yourself easily matching up with these questions, you might be really great for biller. So thinking about these two roles, right? A lot of the skills and the things that we've mentioned here are really skills that can be transferable. So I didn't really talk a lot about the technical skills, right? The things that absolutely you can get training in, because these are skills that we've listed here are vital for our medical office receptionist and medical billers, but they are ones that actually can come from your past experiences and also trained as well. If you're new to the business world completely, you can be trained in these other types of soft skills. Some of these things come naturally, right? The natural desire to investigate, the ability to communicate, and love of learning. Some of those things are just innate. You're just born with them sometimes. All right. So lots of possibilities for you if you don't have the technical skills. So again, pointing back, kind of summarizing our transferable skills and experience. We talked a lot about that already. Customer service, communication, time management, organization, teamwork, and collaboration. Things that are really going to be required are those interpersonal skills and making sure that you have level of professionalism, making sure that you understand that thinking critically and problem solving are so important. Adaptability, because like I shared already, we're changing and shifting a lot in healthcare, right? So really trying to recognize that like stress is a component in all things. So stress management is a transferable skill if you have that or you choose to develop it. All right. Lifelong learning is something that is valuable in any industry, but for sure for our folks in healthcare, because we are needing to keep up with our training and make sure that we are staying aware of new things that are changing in our healthcare sector and new opportunities for us to leverage technology in a way that feels more supportive. So let's talk about your path. What is the thing that's getting you into this healthcare system? What do you need most? All right. We've talked a little bit about what are transferable skills. So I want you to be super honest with yourself, really, really brutally honest with yourself. What am I missing? All the things that Jasmine just said, I don't feel great about communication. I don't really think that I enjoy learning. Like, what are the things that you can start to just illuminate for yourself, so you have a clear list of the things that you feel like you're missing that are going to be necessary to be successful in healthcare. Next is you're going to be getting these skills, right? So developing the skills, the soft skills, the hard skills. I want you to be honest about what you're missing, then identify the skills that can help you to be able to fill those gaps that you think are missing. And then you're going to get out and you're going to get clear on what you need to learn, set your goals, and then start learning. All right. You're setting your goals and then setting this commitment to learn. Next, I want you to get support. All right. You must recognize that we are going to have a lot of discomfort when we're learning something new, right? Helps when we speak to other people about the things that they are challenged with. It helps when we have communities that come around us, like in Inlera University, we have our Facebook group, you have membership, you have folks in the community that are there to help you feel into what exactly are you being faced with that maybe someone else has dealt with in the past, and they can encourage you, or you see someone else's struggle and what they are communicating just helps illuminate possibilities of how you can solve things moving forward, right? Know that you are not the first person to take this journey, and there are people out there that are willing to help lift you up and guide you. So in our community in Inlara University, we are trying constantly to help kind of excavate the folks who are really passionate about serving, the folks who are really interested in being a part of your journey. And so we want to make sure that you are feeling the support, not only from our training and community that we've developed in membership, but also the folks that we allow into the Facebook group. We want folks in there that are wanting to collaborate, that are recognizing the truth of the matter, which is that we are absolutely better when we are unified in our approach and are working together. Lastly here, getting support would also include getting a mentor or a coach to help you and hold you accountable along the way. If you aren't aware of this, that Inlara University actually has coaching for individual billers and folks who are opening businesses, and a couple of other type of coaching as well. And so absolutely check out those options if you know right away that you want to receive coaching from someone on our team, myself, or someone else. Next, you're going to be building confidence. So the truth is, after you've got the skills, after you've started to reach out to others for support, you are going to start building confidence automatically through those things, right? You're getting the skills, you're starting to tap into folks for support. So making sure that you continue to develop yourself, allowing yourself to embrace things like these soft skills and hard skills, and then starting to build on your experience. All of those things together are going to help you build the confidence, because where we find you most satisfied with your job, most fulfilled in what you're doing, is when you have a level of confidence. And that confidence is generated by you doing these things, getting the skill set, being able to make sure that you feel supported in your journey. When you have confidence and you meet this position that you're allowed to kind of fully arrive in, you feel fired up, and it allows that passion to come forward. Right? It's passion and skill coming together that's helping you build that confidence. Passion and skill together is when you start fully showing up whole and confidently you. All right. So let's talk about a little side note of who is Inlara. I already mentioned this briefly at the start. So just to clarify what we do. So in Inlara University, we have an education and consulting group that's committed to enhancing the delivery of healthcare by eliminating the confusion in the U.S. healthcare system. And so if you aren't familiar with our YouTube channel, we have a YouTube channel. You might already be familiar. That might have been how you found us here in this webinar. We also have online training, and we have a community of folks, both a Facebook community and a community of memberships that allow our folks to feel the support and the growing awareness of the team that's around and available to you to be a support maybe outside of the group that you're currently working with. All right. So we now have what we call accessible pricing. So we before had courses that were paid courses, and with our paid courses, we had a little bit of a challenge because we recognize that financially, folks that really wanted to come into healthcare were not financially able to access the training that we were providing. And the truth is we don't want that to be the roadblock. If you're passionate and you feel fired up, you feel interested in this healthcare industry, then we want you to be able to lean in to what's possible for you. We want you to be able to explore this industry openly and find yourself really fulfilled in the industry and really supported along the way. And so we now have accessible pricing. So we have a basic, a pro, and mastery membership levels. So basic membership, most important thing to know with our basic membership is you get access to mini courses. So these are our 101 courses, the courses that are like introductions to the medical billing field, the coding field, the language of the different areas of healthcare, so the different terminology that's used. There's also some downloadables, and then you get access to webinar replays and a private community as well. So something similar to a Facebook group, but this is a private community. So there's a little bit more control and parameters around the folks that are in this this community page. Next is our pro membership. So in addition to our basic level parts to our membership, pro also gets monthly training. We get some professional development training. You'll get some support with job prep and resume review. You get an option to be able to be listed on our medical billers network community if that's of interest to you. We have other meetups and virtual networking opportunities as well. Lastly is our mastery. So with mastery, you get not only our basic and pro level membership. What do we call these things? Membership listings, membership offerings, elements, parts. You also get our programs. So we have a few different types of programs coming down the pike, but right now our Mastering Medical Billing and our Medical Office Receptionist is almost published and live there on the site. And now we have some healthcare leadership training that's being developed as well. Super excited about that. Training that's going to help you transition between roles. So getting you from one role to another, allowing you to feel like you're developing and you're developing your skills and making it possible for you to move from entry level to that next supervisorial level, to that mid-level role, and then moving up to more advancing opportunities in your healthcare organization. So these leadership training programs are vital and instrumental in your success as a healthcare administrator. Next, we have the one-on-one coaching opportunities with our mastery program. So our mastery membership has annually a free one-on-one coaching session and then discounts on additional coaching if you want guidance that will be more handheld. So you are getting one-on-one coaching from myself and other folks on the coaching team as well. And then we have monthly career opportunities, such as the exclusive training and development opportunities that are only available for our mastery level membership. So super excited to offer these membership levels and continue expanding on them. We would love to get feedback from you on things that you're excited about or things that you absolutely want to see in the memberships moving forward. So how do we get started? Been moving back into our content. So here's the deal: is when you're ready to get into healthcare, how do you get started in the healthcare industry for specifically our healthcare administrative roles? So you're going to get out there and you're going to try to find the job by searching in alternative places. So you don't necessarily only have to limit yourself to the Indeeds and the ZipRecruiters and things like that of the world. There are a lot of other places where people are having conversations about what they are looking for and who they are looking for in this area of healthcare. And so get out there into forums, try to find yourself in these different groups and connect with people and try to understand where their needs are and where you might be able to support support them. So really try to you want to stand out by creating a really compelling resume. And so as you learned already, if you have access to our memberships, our pro, I believe, level membership has that resume support. So with the pro level membership, you get an opportunity to allow us to give you feedback on your resume and get your LinkedIn created and make sure that you have a compelling profile there on your LinkedIn account as well. Next, you're going to want to get out there and network. So it's all about who you know. Healthcare community can feel more like a family environment, right? We are oftentimes trying to connect with other family members to get support, trying to find out who do we know to move someone to be able to fill roles in our organizations. And so it's really helpful to know that networking can be invaluable in your journey in this industry. So finding your job can look like this. So getting resume templates on Canva, asking folks for resume review, getting your cover letter, but using a cover letter differently than your resume. I see sometimes people put a lot of information in their cover letter that isn't as supportive. You're going to make sure that you're practicing, you're interviewing. And these are things that, you can workshop, you can get out there and network and ask people for support and say, hey, I've been practicing. This is what I've been saying. What does that feel like? What do you think about that? You can even talk to other folks. Like, I would absolutely encourage you to get into the Facebook group and our membership community and say, hey, who wants to do some some interview practice with me? Like, actually ask folks in the community for support, because most of us want practice and want honest feedback. Get out there and research what type of environment that you might be interested in. Knowing that there are lots of different sizes of practices, you want to know in advance before you start looking for a position and just applying for everything, where you would be most satisfied. If you know that you like a fast-paced environment, you like the fast-moving environment of a hospital or an urgent care, those kinds of environments are different than a private practice, right? If you know that you want a private practice that's a small practice, maybe one provider, where you have a relationship directly with a provider and a closer relationship with patients, then it's a different type of environment. Start thinking about what specialties you're passionate about, right? Explore different training. So there are some videos and things online that you might be able to access. There's some softwares that I mentioned here, Epic and Athena. You may not be able to get full access to training through those programs outside of healthcare, but you might be able to find some useful videos there on YouTube and other areas where people are just giving you a glimpse into the software itself. You might get out there and get your hands on a different system that's free, that can give you more hands-on experience. I'll say a couple. I think that I believe Therapy Notes still has a free level where you can get into software that is a mental health software. There are some other tools out there as well. Office Ally also has a free, or did have a free level. I haven't checked in a little while, so they might not have it free anymore, but they should have a free level available for you to kind of poke around and just see the system from kind of a further an insider view of something outside of a practice that's functioning, but you can get in there and poke around. So you also want to be thinking about ways that you can submit your resume. You can think of alternative ways to get your resume in their hands, like dropping off your resume, sending a targeted message to a practice by way of finding their email address and getting into maybe their direct messaging and social media, right? Recognize that you don't have to go only by way of Indeed and other platforms like that, especially because you probably have these practices right in your area. Even if you're interested in working remotely, there's a lot of opportunity for you to get connected in your local area with practices that are looking for remote team members. So we talked a little bit about the pathway or getting your gateway into healthcare. So let's look at the roadmap here. So first, I want you to be thinking about why. Why are you getting into healthcare? Really think deeper about why you're wanting to break into this new industry, because it's really that North Star that's going to keep guiding you along your way. So there's usually a deeper reason, right? So you're thinking maybe you want to have the resources to put your kids into school or private school, or sending them to college, or just being able to provide more fully for your family. Maybe it's something else that's motivating you be honest about that thing that's motivating you and connect back to that why on a regular basis. Start to think about your journey and really be honest about what the journey is. Like I mentioned earlier, you're going to want to do inventory on what you know and what you don't know and be super brutally honest with yourself about what you need. Next, you're going to commit to the journey. So committing to the journey looks like, this is what I am doing by X date. So you're giving yourself a timeline. If you aren't sure about creating new habits and struggle with that, you can consider looking at one of our last, if you have membership, you can access one of our latest videos where we go over Atomic Habits, which is a really phenomenal book that will help you navigate implementing new habits, because the commitment to a new journey is going to require you developing new habits that are going to be orienting you towards success. Next, you're going to be looking at ways to gain that knowledge. So you've been honest with yourself, you've committed to the journey, and then you're going to get out there and get the knowledge, right? You're getting the access to the community and the support of those around you to help you build confidence. And then as you get the access to that, you're going to continue asking questions as you gain the experience. Continue tapping into the support. Continue asking the questions, all right? 101 mastery for 101. Yes, you can. Can you? Oh, I have a question here. Let's see. Can I use the mastery membership 101 session for interview preparation? Yes, you absolutely can. So that's a really great question. You can use your mastery level memberships one-on-one for anything that you need support in during your journey. So it could be something like resume support. It could be hand holding on how to find jobs. Like we've talked a little bit about getting into internet and getting online and trying to kind of do some research. We can hand hold and actually do that with you on your one-on-one session. We can do some interview prep by actually role-playing the interviewing process with you to help you, encourage you, and also give you pointers on ways that you can improve what you're doing. The one-on-one session would be recorded, so you will have access to rewatch that session as often as you like. So thank you for that question. All right, so your action plan. So whether you are enrolling in a course or applying for jobs, we are here to help. So you guys, we hopefully you found this already while the way that you've been connected to Inlara University, but if not, get more deeply connected with us. We are working to make sure we are helping you in this more deep way. So being able to provide you with the handheld kind of mentorship that you need to get you from where you are now to where you desire to be. And we're looking at really expanding the community so that you guys can also be in a place of supporting and encouraging each other. Like we've talked about some of the things that we have in our memberships levels, such as our virtual networking opportunities. So allowing you guys to speak up and say, this is where I am in my journey, and who's out there that maybe knows ways that you can leverage where you are, or maybe there's folks out there that actually can support you by putting you up for recommendation or introducing you to opportunities that exist. So our community is here, our training is here, the training that we offer is here to help as well. So our last giveaway. So how about this being timely? So we have a 30-minute one-on-one coaching session that we're giving away. You can put coach in the comments to be entered into that giveaway. Coach in the comments to be entered into that giveaway, and we will reach out to you with your 30-minute one-on-one coaching session. All right. Question for you. So did you know about us before you jumped on today's webinar? I'm very curious to know. Let us know in the comments if you knew who we were before you showed up in this environment today. All right, so I want to talk about a quick little bonus, because in this roadmap where we just painted the picture of your pathway into a new industry, your pathway into anything new is going to require a positive mindset. You're going to want to take into consideration where your head is, where your mind is in this journey. Because truth is that our minds can get in the way of pretty much anything. And so I love this image here because it really exemplifies what the mind can be. We can nurture it, we can water it, we can care for it, we can give it all of the seeds that it needs to thrive and to grow, or we can put all of the scared negative emotions and thoughts into it and cause ourselves to be held back and hold us back from the potential for our success in the new industry or any area for that matter. So how do we do that? How do we overcome this limitation that our mind can sometimes grow? So let's think about what we talked about at the beginning of that journey, the why, right? So revisiting your why on a regular basis is going to help you overcome some of the things that are holding you back from making a decision to continue to move into a new industry, continue to excuse me, the decision to continue to pursue and be persistent about that pursuit as well, right? To continue to move forward with a clear mind. Next, you're going to be setting these goals, right? Setting these goals and deciding. So they say deciding is to kill off all other possibilities of things. When you make the decision, it's because you have said very clearly that this is happening. Doesn't matter what it is. I am absolutely doing this. That is you choosing to kill off all other possibilities. All right. Next, you're going to build your network. So building your network, getting connected to folks that you trust, advisors that you feel can actually support you in your journey. And so we've talked about what's possible with Inlara University, but there are a lot of folks out there. If you want to get connected more deeply with us, please do. We are super excited to help you and support you in your journey. What questions are coming up for you as we've navigated these last few moments of our time together? We really want to make sure that you are feeling clear about your path, that you're feeling clear about where you can go from this moment and getting you to that next step. So what questions can I answer for you? While you're pulling up your questions and putting those in the comments, I want you to save the date for our next webinar, March 15th, 2025, our next webinar. Put that on the calendar, make sure that you save that date. And yeah, we're excited to support you and just really grateful that you chose to spend some time with us today. And again, my name is Jasmine Viles, and we're thrilled. We're thrilled to be able to have the skills and the resources available to support you all in this journey in healthcare. And if there are things that you are struggling with in this moment and you need our support, doesn't matter what it is, we would love to know. So let us know in the comments of any of our videos that you see online. You can find us there on YouTube. You can find us on Inlara.com, getting all access to all of the training and community opportunities that are available to you on Inlara.com. All right, my friends, thank you again, and we will see you in the next video or webinar. Take care.